I'm Helena Kirk. Many of you have heard of me before, but when I was 3 years old, I was diagnosed with leukemia, and I underwent 841 days of chemotherapy here at Sick Kids. I have my bravery beads here. And I got one bead for each procedure I endured. I have over 650 beads and counting since I still come to Sick Kids for follow-up treatment. I was one of the lucky ones. I met many friends in my years of treatment and recovery, and I also saw many of those friends struggle to get access to trials and treatments that could potentially save their lives. But ultimately, instead of getting access to trials and treatments that were available for kids in other provinces or the US, they had to accept palliative care instead. When I started my advocacy work in 2017, I wanted to tell Canada's leaders how unfair it was that only 2 drugs had been approved for cancer kids in 40 years. I wanted to tell them that you shouldn't live or die depending on how much money your family has or how fast they can come up with $50,000. I talked about how my friends were being blocked from life-saving trials and treatments by outdated policies and dysfunctional health systems. Canada is the best country in the world, but I had to let the leaders of Canada know that we're failing young Canadians with cancer. I asked the Prime Minister and Ministers of Health, Science, and many MPs, many of them are here today, for their help because they had the power to open up life-saving pathways. I asked them to fund getting the smartest people in Canada together to work on solutions. The funding of the CPCC is the realization of that dream because the CPCC represents unprecedented support and consensus from some of the smartest Canadians working together to find pathways for more children to survive cancer. My advocacy organization, Helena's Hope, has the support of 150 families, 30 leading pediatric oncology researchers, and 40 children's and health organizations, including every Children's Hospital Foundation in Canada. This got us the funds in the federal budget. Then in the last year, over 160 patient advocates, researchers, clinicians, and policy professionals came to consensus on the most effective use of these precious funds in a proposal to CIHR that is being announced here today. The power of building that consensus is that there is now a sea of support for the success of the CPCC. My advocacy efforts were a success, but it took 5 years of hard work and advocacy. Fortunately, I was not alone. I had the executive team of Helena's Hope, who gave thousands of hours of their time, providing over $750 of pro bono work, putting their reputations on the line, having meetings in the evenings and weekends just to help my voice be heard and taken seriously. Adrienne Gerdire, Carolyn Way, Kathy Martin, Joy Gandel, and Julie Jewett. Thank you. You guys are the best. Love you guys. I also want to thank the 150 families in Helena's Hope that went to meet with their MPs and trusted me to represent their voices at powerful tables and important meetings. I could also have not done this without Dr. Whitlock, Dr. Malkin, and Dr. Irwin, who went to meetings with me to provide evidence-based answers to leaders' questions and provided the solutions that will ultimately save kids' lives. Also, Kathy Roder-Robb from C17 had countless calls with my mom and I to help us understand complex issues and answer some of my mom and I's endless questions. I also want to thank MP Erskine Smith, who's my local MP and has been a vital supporter, MP Pam Damoff, who shared my grief for my friends who had lost their lives to cancer, and MP Anita Vandenveld, who was the very first MP I met with and has always encouraged me to be bold and use my voice. Thank you for guiding me and allowing my voice to be heard by the leaders who had the power to make a difference. I also want to thank my friends in CIHR, Health Canada, and the Minister of Health's office who listened to me and worked so hard through roundtables and meetings to make changes that are already saving lives. David Lee, Alicia Crocker, Dr. Robbins, Rachel Symes, and so many others. You took me seriously and you put your brilliant minds to work to help cancer kids. Thank you. And finally, most of all, I want to thank my family and family friends who supported and funded all my advocacy efforts. Thank you for encouraging me through the roller coaster of the last 5 years. Also, hi Mom, I love you. She was there with every meeting, every round table, everything. She worked so hard along with me. Whenever I was up late working for Helena's Hope, she was up late working for Helena's Hope. MP Van Coverden and Dr. Liu, CPCC is the future of healthcare. It's not just a 2-year grant, it's modernizing healthcare, and it is pioneering for other areas of healthcare to more easily follow in our footsteps. In this way, I want you to see this as the start of something and not an end point. Please start planning to fund the areas of CPCC for years to come. This project is paving the way, but it takes time to lead through consensus and to realize the result of a project of this magnitude. And to the dozens of people leading within CPCC, I want you to work really hard. Like lives depend on it, because they do. And they're here at sick kids in hospital rooms all across the country, staring at ceilings, waiting for the miracle that will be the CPCC. And they're not just kids. They're not just a number on a page. They're my friends whose lives depend on your work. Thank you.